Hello, and welcome to the Total Joint Replacement Pre-Surgery class presented by the Medical Center Navicent Health. The purpose of this presentation is to discuss the 3 phases of joint replacement surgery. The preoperative phase, which is where you are now. The operative phase, which will be when you arrive at the hospital. And the postoperative phase, which is discharge and recovery. Knowing what to expect before, during, and after surgery can help you recover more quickly. It can also assist you and your caregiver in avoiding and recognizing potential problems. If there is a difference between this presentation and instructions provided to you from your surgeon, please follow the instructions of your doctor. We will begin with a brief introduction. The Center for Joint Care opened on 7 Main in November of 2009. We have 23 private beds and our own physical therapy gym. The nurses and clinical techs have been trained to care for orthopedic patients just like you. Additionally, there is a joint care navigator available on the floor to provide education, coordination of care, and support throughout your entire surgery experience. Currently, we are performing around 1,000 joint replacements each year. Most people go home within 1 to 3 days after surgery, with help from family or friends. The average length of stay is dropping, due in part to advancements in joint replacement surgery that have made the procedures less invasive, with a faster recovery period. You will be admitted directly from the recovery room to 7 Main. No ICU stay required. And be prepared, our physical therapists will get you up and moving the same day as your surgery. Preoperative phase. Key tasks to do before surgery. Everything gets started in your orthopedic surgeon's office. When you learn that you need joint replacement surgery, be sure to pick up a joint notebook. This notebook contains written material regarding your surgery and recovery. You will also need to see your primary care doctor and any specialists, such as your heart or lung doctor, within 30 days before your scheduled surgery date to receive clearance for surgery. Additionally, you will have 2 separate pre-admission testing appointments, also called PAT or pre-op appointment. One with your surgeon's office and one with Navicent Health Diagnostics. Please remember to bring all medications, including vitamins, herbs, and supplements, or a detailed list to your pre-op appointment. You may also wish to speak to your insurance company to make sure you don't have any unexpected out-of-pocket expenses. You should discuss the type of post-surgery services available, such as home health care, as well as equipment that your plan covers, such as a bedside commode and rolling walker. In the month before your surgery, you will undergo a complete physical by your primary care doctor to rule out other medical problems that may interfere with your surgery. Your doctor will take your medical history and order tests that must be performed before surgery, such as blood tests, urinalysis, and electrocardiograms, or EKG. If you're missing any necessary tests or lab work, these may be completed at Navicent Health Diagnostics during your pre-op appointment. Some surgeons may also order a nasal swab to see if you test positive for MRSA bacteria that many healthy people carry in their nose. These bacteria live harmlessly on the skin unless allowed to enter the bloodstream through an open wound, such as a surgical incision. If the nasal swab is positive, you may be instructed to use an antibiotic ointment called Bactroban in your nostrils for a few days before surgery. One important task to complete before surgery is to enlist a coach. This can be a family member or close friend that helps support you through your recovery process. They are welcome to stay with you overnight in the hospital and strongly encouraged to come to the physical therapy gym with you, so that they can also learn the exercises you will be doing after discharge. Adequate nutrition is also important before surgery. The nutrients from food provide us with the strength, energy, and ability to heal and fight off infection. You should eat meals that contain protein-rich foods, whole grains, fruits, vegetables, and dairy products. If you don't feel like you're getting enough protein or vitamins in your diet, you can add a daily protein drink or multivitamin to your routine. If necessary, be sure your multivitamin contains iron and folic acid to help prevent anemia. Good sources of iron from food include lean red meats, green leafy vegetables, and fortified cereals. You may be instructed to stop all supplements 1 to 2 weeks before surgery. It is highly recommended that you stop smoking before your joint replacement surgery. Smoking can impair oxygen circulation to your healing joint, which may delay healing and recovery. Smoking also increases your risk of infection and blood clots after surgery. Talk to your doctor about nicotine patches and other smoking cessation methods. It is important to be in the best possible physical condition for your surgery. As seen in your joint notebook, there are several prehab exercises that will help strengthen and condition your muscles in preparation for surgery and recovery. You should start learning and doing these exercises as soon as your surgery date is scheduled. It is important to remember to complete the exercises on both sides, not just the side you are having surgery on. These will help reduce muscle soreness and fatigue caused by the use of a walker, cane, or crutches after surgery. We want you to be in the best possible health before your elective surgery so that you have the best possible outcome. Remember to tell your surgeon if you have any signs of infection, such as fever, chills, productive cough, non-healing wounds, toothaches, or facial swelling. You will be given individualized instructions concerning your home medications at your pre-op appointment. You will be instructed to stop medications that increase bleeding 7 to 10 days before surgery. These include anti-inflammatories, such as Aleve and aspirin, and anticoagulants, such as Plavix and Coumadin. You will also be instructed on when to stop taking certain vitamins and herbal supplements. You may also refer to the list in your joint notebook. Please remember to take your medications, or a detailed list, with you to this appointment. If you decide to take a list instead of the bottles, please be sure it has the name of the medication as well as the dose and frequency. Pack a small bag for your hospital stay. You will want to bring loose-fitting clothes to wear to your physical therapy sessions, as well as flat, non-slip shoes that have a back. You may also want to bring personal hygiene items. However, these may also be provided for you if forgotten. Wi-Fi is available, so feel free to bring your cell phones, laptops, or tablets. But remember that you will be out of your room twice a day for therapy, and we do not want these items to get lost or stolen. If you have sleep apnea, you are encouraged to bring your CPAP mask and machine so that you are more comfortable. Also, don't forget to bring your glasses, dentures, and hearing aids so that you can see, eat, and hear while you're in the hospital. You don't need to bring any valuables, large amounts of cash, medication bottles, or assistive devices with you. If you already have a rolling walker, you may leave it in the car so that you have it at discharge. Each hospital room is already equipped with a rolling walker and bedside commode, and we do not want your personal device to get mixed in with ours. Everyone will be screened for obstruction sleep apnea before surgery. Obstructive sleep apnea, or OSA, is a common sleep disorder that affects millions and can increase your risk of complications if unrecognized. If you screen positive for an increased sleep apnea risk, you will receive an extra black and white checkered wristband to wear during your stay. You will also be placed on a monitor after surgery called an end tidal CO2 monitor. This will measure your breaths per minute, how deep you're breathing, oxygen levels in your blood, and your pulse rate. You may also be placed on this monitor if you have a pain pump after surgery, because pain medications increase your risk of respiratory depression. The day before surgery, you can expect a phone call by 4 p.m. to verify your arrival time. The earliest scheduled arrival time is 5:30 a.m. If your surgery is on a Monday, you will be called Friday afternoon. If you do not receive a phone call, you may contact our scheduler at 478-633-1191. Remember, no solid foods after midnight and only clear liquids 2 hours before arrival time. That night before surgery, you will complete your first Hibiclens shower. This antibacterial soap and detailed instructions will be provided for you at your pre-op appointment. You will want to use half the bottle the night before and half the bottle the morning of your surgery. With each shower, wash your hair and face first with your normal shampoo and soap. Rinse your hair and body thoroughly to remove all shampoo residue. Then apply Hibiclens soap to your entire body from the neck down and let it sit on your skin for 3 to 5 minutes. Hibiclens is alcohol-based, so you will want to avoid your eyes and genitals. Rinse completely and do not use any regular soaps or lotions afterwards. After your shower, pat dry with a clean towel. Dress in clean pajamas and sleep in clean bed linens. Operative phase. Hospital care. On the morning of your surgery, take any medications instructed with a small sip of water. Do not take any insulin unless otherwise instructed. You will also need to complete your second Hibiclen shower. Do not wear any makeup or jewelry. The surgery center entrance is located on Pine Street, and the nearest parking garage is the Red Deck, which is directly across from the emergency room and McDonald's. If you have a difficult time walking, we encourage you to have your family or friend drop you off at the entrance. There is also valet parking available for $6. After checking in, the staff will begin preparing you for your surgery. They will draw updated blood work if needed, review consents with you, start an IV, and assist you with changing into a hospital gown. The surgeon or PA will come see you and mark the operative side. If you are having bilateral joint replacements, they will mark each side with a number 1 or number 2. You will want the side that hurts the worst to be the one marked number 1. You will also meet your anesthesiologist or nurse anesthetist at this time. He or she will discuss operative sedation options with you, as well as the risks, benefits, and side effects that can occur. There are 2 main options for sedation during the procedure. The most commonly used option is referred to as a block with twilight sedation. This is where medication is placed in your back that will numb the lower half of your body. With a block, you are not paralyzed and are still breathing on your own. You will be in a twilight sleep and will not feel any pain. You will also receive a urinary catheter to help empty your bladder until the block wears off. Advantages include less nausea, less drowsiness, improved pain control after surgery, and reduced risk of serious medical complications, such as heart attack or stroke. The other common option is general anesthesia. General anesthesia may be selected based on your history, the surgeon, the type of procedure or anesthesiologist preference. Unlike regional and local anesthesia, general anesthesia affects your entire body and requires a breathing tube. You will not feel any pain and will be asleep through your entire surgery. Preoperative preparation takes about an hour. Your family or friends are welcome to stay with you until you're ready to enter the operating room. After you enter the operating room, your loved ones will either wait in the surgical waiting room or in your room on 7 Main. The actual procedure will last approximately 1 to 2 hours. Once completed, you will be in the recovery room for 1 to 1.5 hours, where you will be cared for closely by a nurse, and an X-ray of your new joint replacement will be taken. Once you arrive on 7 Main, you will begin meeting your team. Your team will include a nurse, clinical tech, joint care navigator, respiratory therapist, physical therapist, and occupational therapist. It is normal to drift in and out of sleep until the anesthesia completely wears off. You will be started on a clear liquid diet first to be sure you can tolerate food. Increasing food slowly may help reduce nausea that sometimes happens after anesthesia or the use of pain medication. Anti-nausea medications will be provided if needed. It is our goal to manage your pain adequately during your hospital stay. We realize pain management is not perfect, and that you will have some discomfort after surgery. We aim to make you comfortable enough to rest and participate in physical therapy. We use a combination of methods to decrease post-operative pain. Pain management starts during the surgery. Your surgeon will inject a mixture of medications directly in and around the joint itself that will help reduce your pain during your recovery. The spinal block will take care of most of the pain directly after surgery because the numbness often lasts for a couple hours. Once you start to regain sensation or feel tingling in your feet or legs, you will want to start taking pain medication, either through your IV or by mouth. We encourage you to take your pain medication once you start to feel the pain, and not to wait until the pain becomes severe. Some surgeons will start you on a PCA, often called a pain pump, in the recovery room. If you have a pain pump, you will be able to press a button and receive a preset dose of pain medication through your IV. The pain pump will be discontinued the morning after your surgery as you transition to taking oral pain medications, which provide longer-lasting pain control. Some surgeons elect not to use pain pumps because the side effects, such as nausea, vomiting, and drowsiness, can interfere with your rehabilitation. Work with the doctors and nurses to find what medications work best for you. In addition to medications, we will also use ice and elevation after therapy to help with pain and swelling. Your risk of falling is much higher after surgery, especially when you're taking pain medications. Your nurse will remind you to call for help whenever you need to get out of the bed or chair. If your nurse and clinical tech are busy when you call, they will find someone to help assist you. We have bed and chair alarms that help alert staff if you get up without assistance. You will also have yellow non-skid socks and a yellow wristband that will help other hospital staff know that you are at a higher risk of falling. Please remember to call before you fall. Physical therapy is one of the most important aspects of your recovery. Expect to be up and working with a physical therapist the same day as your surgery. Remember to do your prehab exercises before surgery so that you are already ahead of the game with therapy. In addition to walking with assistive devices, the therapist will help you with sleeping positions, moving from sitting to standing, walking up and down stairs, and learning the hip replacement precautions if necessary. Your first session will be one-on-one with a therapist, and then you will be assigned 2 gym times per day for group therapy. We do group therapy sessions once in the morning and once in the afternoon. There are many benefits to performing therapy in a group setting. Our gym is a welcome, inviting atmosphere that makes performing exercises more fun. Patients often encourage each other and even compare how they are doing to other people who have had the same surgery. Nothing wrong with some friendly competition. Remember to ask for your pain medication 30 minutes to 1 hour before your assigned therapy sessions. The better your pain is controlled, the easier it will be to complete all the exercises. We have set goals of walking 150 feet by discharge and being able to bend your knee 90 degrees and straighten it within 5 degrees. We have 50-foot markers on the ceiling of 7 Main so that you will be able to monitor your progress. These are just goals and are not required for discharge. We will provide any assistive devices that you need during your hospital stay. Each room is equipped with a walker and bedside commode. Typically, patients will start by using a rolling walker and progress towards independence as instructed by the physical therapist. A bedside commode is handy because it can be used over your toilet at home and as a shower seat. Let your discharge planner know any medical equipment needs for home use, and we will order those items through your insurance and have them delivered to your room prior to discharge. In addition to a physical therapist, you may also see an occupational therapist. These therapists are here to help you with your activities of daily living, such as using the bathroom, taking a shower, and getting dressed. For our total hip patients, you will receive a hip kit that comes with a long-handled reacher, shoehorn, sock aid, and bath sponge. The therapist will teach you how to use each item. Your recovery and physical therapy will continue into your home after discharge from the hospital. Be sure to prepare your home for your safe return. You may need to declutter and remove obstacles so that you avoid tripping hazards, such as throw rugs and electrical cords. Remember that you may be using a walker, so you will need a clear, wide path from the bedroom, bathroom, and kitchen so you can move freely about. You may also want to install or secure fall prevention devices, such as handrails or grab rails, but these are not required. If you live in a 2-story home, it is beneficial to create a recovery space on the first floor until you are strong enough to go up and down stairs again. When using stairs, you should climb them 1 step at a time with the good leg up and bad leg down. To avoid bending and reaching, keep frequently used items within easy reach. Small pets may also pose a safety hazard if they are prone to jumping or getting under your feet. You may need to make arrangements to keep pets in another area of the house when you arrive home, or let them stay with a loved one until you are stronger. Lastly, purchase food and hygiene items before surgery. It's handy to have frozen peas or corn on hand because they can be used as ice packs. Postoperative phase. Recognizing and preventing complications. Complications after joint surgery are rare, but like any other major surgery, joint replacement carries risks. Today, we will discuss blood clots, pulmonary embolism, infection, pneumonia, and hip dislocation. Signs and symptoms of a blood clot are swelling in the calf, thigh, or ankle that does not go down with elevation, redness, pain, and warmth. If suspected, an ultrasound will be ordered to determine if a blood clot exists. Patients will skip therapy and all activity until a blood clot can be ruled out. Blood clots can break off and travel to the lungs, where they are called a pulmonary embolism. Signs and symptoms of pulmonary embolism are shortness of breath, chest pain, difficulty breathing, sweating, and confusion. Call 911 for this medical emergency. Blood clots and pulmonary embolisms can be prevented. The best way is to get up and get moving. You will be encouraged to perform ankle pumps often. These can be done while lying in bed or sitting up watching TV. We also use compression devices to improve circulation. These are either on your calves or ankles and will be placed on before surgery. These devices will squeeze your legs or feet every few seconds to keep your blood from pooling in your lower extremities. Another major prevention method is blood thinners. Each patient is placed on a blood thinner after surgery. The type and dose will depend on you and your surgeon. Some common options are aspirin, Xarelto, Lovenox, and Coumadin. Some food and supplements may alter the effectiveness of blood-thinning medications, such as Coumadin, so be sure to talk to your nurse or surgeon about diet changes that may be necessary. Typically, these medications are taken for 2 weeks to 1 month. Infection is another potential complication. Signs and symptoms include persistent fever, warmth, redness, swelling, and pain or tenderness around the incision. You may also notice more or foul-smelling drainage from the incision. Preventing infection is important for the rest of your life. Your new joint is artificial and does not have your body's natural protection against infection. Hand washing is the most important step in preventing infection. Make sure you and your caregiver wash your hands prior to any dressing changes or wound care. You will receive antibiotics before and after surgery as a preventative measure. You may also be instructed to take antibiotics before certain future procedures, such as dental work or colonoscopies. Wound care is very important after discharge. Be sure to follow your surgeon's instructions on how often to change the dressing. Make sure you keep the incision clean and dry. No ointments, creams, or lotions until the staples are removed. How soon you can shower will depend on your surgeon and ranges anywhere from 3 days to 2 weeks. No tub baths until the incision is completely healed. If you're a diabetic, be sure to control your blood sugar levels because increased blood sugars can increase your risk of infection. The stress before and after your surgery may cause your body to release hormones that make it more difficult to manage your blood glucose levels, so you may be monitored more closely during your hospital stay. Pneumonia is another potential complication. Signs and symptoms include productive cough, fever, and chills. You can prevent pneumonia by doing deep breathing exercises every hour with your incentive spirometer. Your respiratory therapist will instruct you on using the incentive spirometer when you arrive on 7 Main. Another prevention method is to get up and get moving. Rarely, artificial hips can dislocate. If you are having a posterior hip replacement, we want to make sure you are aware of the 3 hip precautions. Do not bend greater than 90 degrees at the waist. Do not cross your legs. And do not point toes inward or twist your operated leg. You will work with your physical therapist to learn these precautions before discharge. Postoperative phase, discharge and beyond. You should start thinking about your discharge plan before having surgery. Your discharge planner will discuss your discharge options with you and your family. The discharge planner will take your personal preferences and your insurance coverage into consideration. Be sure all equipment needs have been addressed. If you're going home, all equipment should be delivered to your room before discharge. You will be discharged once you are cleared by your orthopedic surgeon and your medical doctor. You will need to make sure you have transportation and someone to pick up your new medications on the way home. If you need transportation to another facility, this can be arranged for you. Your options for discharge include home health care, acute rehab facilities, subacute or swing beds, and outpatient therapy programs. The best option across the country is to get back into your own home environment. But if you require extra help, there are options available. Bear in mind that insurance companies have certain coverage limitations or criteria that must be met for acceptance to some facilities. Our discharge planner will work diligently to get you where you want to go, but it is always wise to have a backup plan. Between 80 to 85% of total joint patients elect to go home with home health care. Physical therapists will complete therapy with you in your own home environment and provide wound care, such as dressing changes and staple removal. You should receive a phone call within 24 hours of discharge from the hospital to set up an initial visit. The physical therapists typically come out 3 to 5 times a week for 4 to 6 weeks, depending on your needs. Remember to continue taking pain medication prior to therapy sessions at home. Pain should be getting better each day. As you have less discomfort, you can start to decrease how many pills you take and how often you're taking them. Eventually, you will no longer need pain medication. Make sure you're completing your physical therapy routine even on days that the therapist does not visit. Continued exercise is important at this early stage to achieve the best possible outcome of your new joint replacement. Your goal is to regain strength and function. Try not to stay in bed or sit for long periods during the day. It is normal to have some stiffness after long periods of inactivity. You may find it beneficial to take frequent short walks every 30 to 45 minutes while awake. It is also important to continue to ice and elevate for 20 minutes after each therapy session. Swelling is normal and expected after surgery. Swelling can increase pain and limit your range of motion, so taking steps to reduce it is important. Be sure you are elevating above the level of the heart. It is important to elevate the entire leg, down to the ankle. Never put a pillow just behind your knee so that your knee is in a bent position, because this may delay your ability to fully straighten your knee. You may continue to elevate and ice as needed to help decrease swelling and discomfort. A good rule of thumb for ice is 20 minutes on and 1 hour off. Using a bag of peas or corn can easily form to your joint. One of the most common complaints after surgery is constipation. You will be at a higher risk of constipation due to your pain medications, decreased activity, decreased appetite or fluid intake, and anesthesia. This can be easily avoided by starting a stool softener prior to surgery. You will be given a stool softener called Colace twice a day while on 7 Main, and we encourage you to continue to take one in the weeks following your discharge. No prescription is necessary. During the first few weeks after discharge, you should be making progress day by day. Most patients are eager to report their progress at their follow-up appointment. Your follow-up visit will be 2 to 4 weeks after your surgery. It is at this visit when your surgeon will tell you when it is safe to resume activities such as driving or returning to work. If you have any questions, please call the Joint Care Navigator at 478-633-7722. Thank you for choosing the Medical Center Navicent Health. We wish you the best with your new joint replacement.